Hello, my name is Dr. Austin Reel. I am a general dentist at Family Tree Dental. And if you're watching this video, perhaps it's because you are trying to decide where to do your residency. We'd like to give you a chance to get to know our practice. During this video, we'll take you on a tour of the office. Hopefully we can show you some of the operatories and see the team in action so that you can decide if perhaps this would be a good place for you. It's a pleasure to participate in a residency with New York University in their dental program. Family Tree Dental is a facility located in southeastern Ohio. Our office has multiple locations, but the residency is done in a 15 operatory facility with a number of attending doctors. I'm there on Mondays, and it's a wonderful experience to be able to be a mentor, to work side by side with the residents who come to our facility to learn and prepare themselves for general practice. The procedures that you'll learn will touch on a variety of the dental specialties. There will be some emphasis, especially in becoming a talented general dentist, but you'll do procedures that are also included in pediatric dentistry, orthodontics, prosthodontics. You'll have a chance to see a hygiene program that is operating effectively. You'll see a perio program in process, and that'll help you give the best care to your patients in the future. As part of your training, you'll also be able to do a number of oral surgery procedures. You will be trained to do extractions effectively. There might be instances where you need to do pathology as well. It's an exciting time to be able to graduate from dental school and then be able to apply what you've learned in a private practice setting with real-time procedures and dentists who are there for you to help you along. Our staff is made up of about 40 people. We have a fantastic support staff. You'll have assistants that work with you, and you'll have access to the facility in the same way that the attending doctors have. Usually we start each day with what we call a morning huddle. That starts at 6:45, and we go through the schedule. We look at what patients are coming in. Perhaps we'll discuss a health history or special needs in terms of laboratory requirements. And then we'll start our day at 7 a.m. seeing patients. We have an hour for lunch, and then we usually wrap up around 4:30. The team is energetic. We have people on our staff from a variety of ages. Most of our dentists are younger. I think I'm the oldest dentist in the group. So as far as the experience level, we have 8 dentists right now. 4 of those dentists will be your attending doctors. Family Tree Dental was established 11 years ago. In that time, we've grown rapidly because we live in an area and practice in an area where dental needs are significant. So there will be times when you'll be doing comprehensive exams and meet a number of families where perhaps dentistry wasn't something that they grew up with, having access to the services. Perhaps they weren't well trained in terms of oral care at home. And so you'll have a great responsibility to touch their hearts and change their minds perhaps to help them have better oral health. That's part of our mission. Some of our goals include solving the problem of access to dental care in Appalachia and beyond, beginning in the Mid-Ohio Valley. We also believe that the answer, when possible, should be yes, no matter what the question is. And we try to put a smile on everyone's face and treat them with respect. If you choose to do a residency here at Family Tree Dental, I can commit to you that you'll be welcomed with open arms, that you'll be brought in as a friend, and we'll share what knowledge and experience we have with you so that you can be the best dental professional that you can be at the end of your residency. Our residency is for the general dentist, but you will do procedures that touch on a variety of the specialties. You'll learn to do stainless steel crowns and pulpotomies. Perhaps you'll do some orthodontics. Placing implants and restoring them is something that we would expect our residents to have the opportunity to do. Fixed and removable prosthetics. You'll learn how to do dentures and partials. You'll learn what makes them work. When is it appropriate to recommend one option versus another? If we can help you dial in your treatment plans so that you feel confident and it's in line with your skills, then that'll make you a better clinician and it'll be of great service to your patients. So the typical day at Family Tree Dental, it's usually fast-paced. We see a lot of patients, and it's not uncommon to have the music playing and high-five someone in the hallway, and you turn over a room and get ready for the next patient. So to be straightforward with you, it is what I would consider, in most instances, a fast-paced, energetic environment. There are days that are slow, and there are times when inclement weather might make the schedule less filled than you'd like, and there are times patients cancel, but there's a significant amount of didactic work for you to do as a resident. And on the clinical side, there's no hesitation on our part to shift things from one schedule to another to make sure that you have a schedule that is optimized. We practice in a community that is very close to the Ohio River. We're on the Ohio side, but we see a lot of patients from West Virginia as well. We're considered Appalachia, and Appalachia is known to have great dental need. So we see people from both states. We have a practice in West Virginia as well as 2 in Ohio right now. And the town is fantastic. It was the first settlement in the Northwest Territory, Marietta, Ohio. And it was surveyed by George Washington back in the 1700s, so there's a lot of history. There's also a thriving art community. We have a small college and a hospital, and it's a great place to live. There are more cobblestone streets in Marietta than in any other town in Ohio. And the summer and fall and spring is filled with festivals. During the wintertime, the holidays are celebrated and decorations are put out. It's a beautiful town. It's a wonderful place to spend time learning as a professional, to make friends, and to visit. We love it here. One of the reasons we decided to participate in the residency with NYU was so that we could not only improve access to dental care for our population, but also improve access to clinical opportunities for upcoming dentists. Our practice is growing, and some of the residents that come through our facility we hope to partner with in the long term, to have them find that this place would be a good place to be their home and to stay with us. But nevertheless, no matter what your plans are, during your residency, our goal will be to help you prepare for your future and find joy in the profession that you've chosen. Hello, welcome to Family Tree Dental. I'll take you for the tour of the office. Follow me. The first thing to know is that our mantra is comfortable, convenient, and kind. That's what we try to do for all of our patients, and hopefully we succeed most of the time. This is our waiting room, plenty of space for people to get comfortable, and we try to be on time. When our assistants come to get the patients, they walk through this door, come out, greet the patient in a friendly manner, and bring them back to their appointment. If you'll follow me down the hallway, I'll take you to see the operatories. These first treatment rooms are used for hygiene. We'll have 1 or 2 hygienists working out of 2 rooms. Our hygiene team works assisted. Our sterilization supports 15 operatories in this office. We made a very efficient use of our space. So our supplies are all organized. You can clearly see what we have. We use the M11 autoclaves as well as an M3 for ultra-fast sterilization. That's the dirty side, all the way to the clean. So all of the rooms are universal. They're set up with individual lights and chairs. We do have a couple of places in the office where we can take radiographs, as well as handheld units that go into the rooms. So you have some options when it comes to imaging. All of the charts are digital. We make use of intraoral cameras as well. We're standing in the long back hallway. We have operatories 7 through 15 on this hallway, and it makes for a very efficient use of space. We also have a place to take x-rays in the middle. In our office, we have a relationship with the Ohio State University as well as with NYU. We have residents come for longer periods of time, and dental students that are in their 4th year will spend rotations based in weeks. So the office is set up with circular flow from check-in to treatment rooms to check-out. I'll take you by the front desk on the way out, and as well as the exit door. This is where our patients check out, and this is where they get to go home.